Hi, my name is Kat. I'm going to be the physician assistant student taking care of you today. Today I'm going to be performing an abdomen and a musculoskeletal exam. Before we begin, I'm going to wash my hands. In the meantime, you take off your shirt, your shoes, and your socks. And if you have to empty your bladder, now would be the time to do so. Alright, so for the abdomen exam, I'm going to have you lay down on the exam table. Okay. And you pull your face a little bit further down. Okay, so I'm making sure I have adequate exposure from the xiphoid process to the pubic symphysis. I'm going to start by noting the abdomen's contour. I'm going to look for the presence of any scars, striae, distension, masses, pulsations, and the condition of the umbilicus. Okay. So I'm going to start with auscultating or listening to bowel sounds in all 4 quadrants. If I don't hear bowel sounds in each quadrant right immediately, I'll listen for at least 1 full minute. All right, normal active bowel sounds were heard in all 4 quadrants. I'm going to move on to percussion now. So I'm going to percuss in all 4 quadrants, listening for tympany and dullness. Okay. I'm going to percuss your spleen now for splenic enlargement. So I'm going to locate underneath the lowest intercostal space along the anterior axillary line. So for this, I just want you to take a deep breath in and then a deep breath out, and then I'm going to percuss the whole way. Okay, go ahead. Okay. All right, moving on to percussion now, palpation now. Are you in any pain? Okay. If you were, I would ask you to point to where your area of pain was and save that area for last. Okay. I'm going to just start by lightly palpating the abdomen, looking for any signs of distress on your face and any superficial masses. Okay. Moving on to deeper palpation, I'm going to palpate deeper, still looking for any signs of distress on your face and any deep masses. Okay. So next thing for palpation is I'm going to place one hand underneath your right upper quadrant. I'm going to palpate for splenic enlargement, tenderness, and masses. So I'm going to ask you to take a deep breath in. And then a deep breath out. Okay. I'm going to move on to the left upper quadrant now, placing my hand underneath there. I'm also going to be palpating for splenic enlargement. So same thing, just take a deep breath in. Okay. And then a deep breath out. Okay. Good. All right, so now I'm going to have you sit up and face the wall. So I'm going to place one hand on your back, and you're going to feel some light taps. Okay, I'm checking for CVA tenderness bilaterally. All right, and now I'm going to perform a rectal exam. So that's the end of the abdomen exam. So I'm going to have you stand up and face me over here. All right, so we're going to move on to the musculoskeletal exam now. For this examination, I'm going to be inspecting and palpating for symmetry. Looking for any signs of inflammation, edema, effusions, deformities, malalignment of bone, tenderness, muscular atrophy, abnormal movements, the condition of surrounding tissue, crepitus, and the ease of range of motion. Okay? So I'm going to start by looking at your posture from the anterior and the posterior view. Okay? I'm looking at the alignment of the shoulders and the pelvis. I'm going to look at the spinous processes, the paravertebral muscles, the trapezius, the scapula, and the sacrum. I'm going to move to the lateral side of your posture now, looking for the lordotic and the kyphotic curvatures. Okay. I'm going to move on to palpating your spine now, okay? So I'm going to palpate, move your hair a little bit, the spinous processes. Okay. The paravertebral muscles. All right. I'm going to palpate the sacrum and then the sacroiliac joints. Okay. So now we're going to move on to your spine's range of motion. We're going to start on the cervical spine. So I just want you to perform a few movements that I do. Okay. So starting with flexion, I want you to bring your chin to your chest. Okay. Extension, bringing your head all the way back as far as you can go, going back to midline, and just look towards your left and your right. Okay, so that's a left and right rotation. For lateral bending, I want you to bring your ear towards your shoulder. Okay, other side. So that's left and right lateral rotation. Okay. All right. So for thoracic and lumbar spine, I'm going to stand behind you and stabilize your hip joint, and I'll have you reach down and touch your toes. Flexion, and then for extension, just to reach back as far as you can go, like you're doing a back bend. Okay. For rotation, I want you to look over to the left and to the right. You can move your chest too. Okay. And then for lateral bending, I want you to glide your arm down your thigh. So left lateral bending, and then right lateral bending. Okay. All right, we're gonna move on to inspecting the upper extremities now. I'm gonna start by inspecting, and then I'll move on to palpation. So I'm gonna start with one arm and then move on to palpation on the other side. Okay. All right, so I'm inspecting the clavicles, the acromion, acromioclavicular joint, the proximal head of the humerus, and the scapula. I'm looking at the area over the arms, the antecubital fossa, medial and lateral condyles, the olecranon process, and the proximal head of the radius, the forearm, looking at the radial and the ulnar styloid, the carpal bones, you can spread your fingers for me, looking at the anatomical snub box, the metacarpals, and then the individual interphalangeal joints. Okay, now I'm going to move on to palpating everything I just named. Okay, starting at the clavicle, acromion, acromioclavicular joints, the bicipital groove or intertubercular groove with a tendon, okay, the area over the arm, the medial and the lateral epicondyles, the proximal head of the radius, the olecranon process, the area over the forearms, the radial and the ulnar styloids, the carpal bones, and then spreading your fingers, palpating the anatomical snuff box, the metacarpals, okay, and now the individual interphalangeal joints. All right, and then I would do everything the same on this arm, but we're gonna move forward. Okay. All right. So since we palpated all that, I'm gonna move on to range of motion now. For range of motion, we're gonna start on our shoulders. So same thing like before, just repeat the movements that I do. Okay. So for flexion, I want you to bring your arms up. Okay. Extension, bring it all the way behind you. All right. So abduction, I want you to bring your arms away from you, all the way up, and then adduction, bringing it back down, crossing at the midline. Okay. We're going to go into this neutral position, bring your arms up, external rotation, bring you neutral, back down, internal rotation, okay? And then now you can kind of make a ball with your hand and then just make circles. So that's circumflexion. All right, moving on to the elbow joint now. Go into this neutral position. I want you to basically do a bicep curl. So elbow flexion, neutral, elbow extension. Okay. Back to here. I want you to bring your arms this way, and then back this way. So that was pronation and supination. Okay? Working on the wrist now. I'm gonna have you bring your whole hand towards you. So wrist flexion, away from you, wrist extension. Now with the pinky, I want you to bring it towards yourself. So that's ulnar deviation, and then radial deviation, bring it away. Good job. All right, moving on to the individual joints in your hands. Just basically perform what I do. So starting with thumb flexion, finger flexion, finger extension, thumb extension. You can bring your fingers together, spread them apart. So that's thumb adduction, or not thumb, finger adduction, finger abduction. Okay, you can turn it to the side. Bring your thumb away. So thumb abduction, bring it back down, thumb adduction, flip it back this way. And now you can touch each of your fingers with your thumb. Okay, thumb opposition. Okay? So that concludes the upper extremities. We're going to move down to the lower extremities now. So I'll have you lay back down on the exam table. All right, we're going to start with inspection. So I'm going to start at the hip joints. I'm going to be looking at the hip joint, the greater trochanter, the anterior superior iliac spine, moving down to the thighs and the knees, looking at the medial and the lateral condyles, the patella, patellar tendon, tibial tuberosity. I'm looking at the calves now, okay? And then for the ankle, I'm looking at the Achilles tendon, looking at the tarsal bones, the medial and the lateral malleoli, the metatarsals, okay, metatarsals, and then each of the individual's toes, interphalangeal joints, okay? So basically, we're gonna go on to palpation and palpating everything we just named. So at the hip, starting at the hip joint, the greater trochanter, the anterior superior iliac spine, palpating the thighs now, and moving on to the knees, palpating the medial and the lateral femoral condyles bilaterally, the patella, patellar tendon, the tibial tuberosity, the calves. Okay, now onto the ankle, palpating the Achilles tendon, okay, the calcaneus, the medial and the lateral malleoli, the rest of the tarsal bones, okay, the metatarsals, okay. And now palpating in between each of the interphalangeal joints of the toes. All right, so that's palpation. We're now gonna do range of motion of your hip and your knee. So I'm gonna move your hip and knee in different directions, and I'll name the actions that I'm doing. So I'm gonna start by bending your knee. So that's gonna be knee flexion, bending into your hip, so hip flexion. I'm gonna bring your knee out. So that's external rotation, internal rotation. Okay, extending your leg back down. So knee extension. I'm gonna stabilize your hip. I'm doing hip abduction. Okay, hip adduction. Now I'm gonna do everything again on this side. So I'm gonna come on this side now. All right, I'm gonna start by bending your knee. So knee flexion, hip flexion, external rotation, internal rotation, knee extension. We're gonna start with hip abduction, hip adduction, and putting it back down. Now I'm gonna ask you to turn on your side. You can face this wall to start. You can hold on to the exam table if you need. I'm just gonna do knee extension. So I'm gonna bring your leg back. All right, and then once again on the other side. All right, hip extension. All right, you can lay back down. And then we're going to do your ankle now. So I'm going to be doing a range of motion on the ankle. So I'm going to start by dorsiflexion, plantar flexion. We're going to do inversion, eversion. Same thing on this foot, dorsiflexion, plantar flexion, inversion, eversion. I'm going to stabilize the metatarsophalangeal joint, and I'm going to ask you to just curl your toes, flexion, and then bring them back up, extension. Same thing here, flex your toes, extend your toes, wonderful. All right, so now the last few things of the exam is I'm gonna ask you to bend your knees, and I'm gonna measure your calf circumference, and then I'm gonna use this joinomer to see the angle of your knee joint. So I'm gonna bring up your pants as much as I can. Okay. Okay. So I'm going to use my measuring tape to see how much your calf circumference is. Okay, it's about 13. And then measuring from that point to the tibial tuberosity, it's around 4. So I'm gonna go ahead and measure it on this side too. Okay, same thing. Okay, it's about 13. And then from here to tibial tuberosity, it's about 4 as well. All right, the last thing is using the joinomer, and I'm going to ask you to bring your knee as close as you can to your hip. Okay, so I'm going to make sure it's in line with the greater trochanter and the lateral malleolus of the foot. Okay, it's about 30 degrees. And I'm going to check on this side too, so bring your foot all the way in. Again, making sure it's in line with the lateral malleolus and the greater trochanter. All right, so it's also about 30. All right, and that concludes today's exam.